Welcome to the deep dive. Um, for those of you listening today, whether you're, trying to quit nicotine yourself, or maybe you're thinking about making that leap, or honestly just trying to support someone in your life who is, we have a really, really compelling mission today.
We do, and it's such an important topic.
It really is. So we are unpacking this vital briefing from Coping and Healing Counseling. They're a telehealth therapy practice based out in Georgia. And our goal today is to explore exactly why quitting vaping or smoking is just so incredibly difficult.
Right. And, how a highly accessible support model can completely change the entire landscape of recovery.
Exactly. But before we get into those solutions, I want you to just think about how we normally look at health issues. Like usually when we talk about a medical diagnosis, there's this, I don't know, this expectation of precision.
Yeah, like it's engineering or something.
Right. It's like you fall, you break your arm, you go get an x-ray. The image shows that jagged white line, and the doctor just points at the screen and says, there it is.
And honestly, it is incredibly comforting to have that kind of visual proof.
Oh, absolutely.
We naturally want our medical issues to be visible, right?
Yeah.
Like neatly categorized, easily fixable with a cast or a straightforward prescription. We really crave that binary clarity.
We do, but then you step into the world of addiction, specifically something as culturally normalized yet deeply stigmatized as smoking or vaping.
Right.
And suddenly that x-ray machine is just totally useless. We're looking at a diagnostic landscape that is incredibly murky, mostly because society has historically treated as like a behavioral choice rather than a medical reality.
Which is exactly why the source material we are examining today is so refreshing. It takes this profoundly empathetic, strictly medical approach to the issue. It intentionally strips away all the moral baggage and judgment we usually attach to tobacco use. And it asks us to just look at the clinical reality of what is actually happening in the brain.
And there is a line right in the beginning of their documentation that really sets the tone for everything we are going to talk about today. I want to read it verbatim, actually, because if you take nothing else away from this deep dive, you really need to hear this.
It's a powerful quote.
It says, if you've tried to quit and it keeps reeling you back in, it is not weakness.
Man, that is a massive paradigm shift.
Right.
Culturally, for decades, we have framed quitting smoking as the ultimate test of willpower. Like, we treat it like a moral failing if you can't just, throw out the pack or the vape pen and walk away.
Totally. Just cold turkey.
Exactly. But this documentation demands we shift our perspective entirely. It classifies tobacco use disorder not as a bad habit or some character flaw or lack of discipline. It calls it a severe medical condition.
Okay, let's unpack this. Calling it a real medical condition isn't just a polite way to make people feel better about struggling, right?
Not at all.
It's a clinical classification driven by nicotine, which this text explicitly reminds us is one of the most highly addictive substances on the planet.
Yeah, and when you start viewing this through the lens of a highly addictive substance actively altering human biology, well, the entire conversation shifts.
It has to.
It moves from shame, which is useless, to strategy, which actually saves lives. So to understand how to beat this condition, we first have to understand the physiological mechanics. We have to look at how nicotine just takes over.
Right, because when you look at the clinical reality of tobacco use disorder, it manifests in very specific ways. The text highlights a core set of symptoms. We are talking about overwhelming cravings.
Oh, yeah.
We are talking about continuing to use the substance even when you are painfully aware of the physical or financial harm it's causing you.
And that's a big one.
Yeah. And crucially, we are talking about building a tolerance where you find yourself needing more and more of the substance just to feel what you would consider quote-unquote normal.
That concept of tolerance is really the invisible engine driving the entire disorder. Well, when a person first introduces nicotine to their system, it triggers a massive unnatural flood of dopamine. That's the brain's reward chemical.
Right, the feel-good stuff.
Exactly. It feels good. It feels like a stress reliever. But the brain is highly adaptive. It recognizes this unnatural flood and thinks, okay, there's way too much dopamine here. I need to turn down my own natural production.
Wait, so you're saying the substance isn't actually providing a high anymore? It's just like paying off a biological debt that the nicotine itself created?
Precisely. Your brain actually changes its physical structure. It creates more nicotine receptors, and it stops producing enough natural feel-good chemicals on its own.
Wow.
So you aren't smoking or vaping to get a pleasant buzz anymore. You are smoking just to stop the biological alarm bells from ringing. You're using the substance just to stave off the withdrawal of not having the substance.
It feels like a moving finish line. Like you start out running a race to feel good, but very quickly the baseline of just feeling okay keeps getting further and further away.
Yeah, that's exactly what it is.
You have to consume more, puff more often, just to stand still. You are constantly chasing a feeling of normalcy that the vape or the cigarette originally stole from you.
What's fascinating here is the intense psychological paradox that creates.
Yeah.
As you mentioned, one of the primary symptoms is knowing the harm and keeping going anyway.
Yeah. Which is so frustrating for people.
Oh, incredibly. But this is where the willpower argument completely falls apart.
Yeah.
Because the logical part of your brain, the prefrontal cortex that reads the warning labels, calculates how much money you're spending, worries about your lung capacity, that part is fully intact.
You're right.
It's completely aware of the danger.
It's like an internal war. You know it's terrible for you. You actively want to stop. But you find yourself walking to the convenience store to buy another pack anyway, almost like you're on autopilot.
Because the medical condition, the physical rewiring of your reward pathways is literally overriding your logic center.
That's wild.
The biological drive to satisfy those starving nicotine receptors is louder and faster than the logical knowledge of the harm. That is the hallmark of addiction as a disease. Your logic isn't failing you. Your biology has been hijacked.
So if logic isn't the problem, what happens when you try to force logic on the situation and just quit cold turkey?
Well, the brain violently fights back.
Right. And that brings us to the next vital piece of this documentation, because these physical symptoms don't exist in a vacuum. They actively sabotage your mental and emotional state.
Oh, completely. The mind and the body are intrinsically linked, and nowhere is that more apparent than in nicotine withdrawal.
The text lists out the very specific withdrawal symptoms you encounter when you try to stop. It's intense irritability, severe anxiety, restlessness that makes you want to crawl out of your skin, and a really frustrating foggy focus.
Just awful stuff to push through.
Yeah, and then it drops this massive piece of context that I think explains why so many people fail. It notes that tobacco use disorder very often rides along with depression and anxiety.
That phrase is critical. Rides along with.
Yeah.
It paints a picture of co-occurring conditions traveling in the same vehicle, deeply influencing one another. They aren't separate issues. They are intertwined.
But, I have to push back on something here, or at least ask a question that I know a lot of people listening are probably shouting at their devices right now.
Go for it.
If quitting smoking or vaping is the ultimate healthy choice, arguably the best thing you can do for your heart and lungs, why does the text specifically warn that quitting can briefly stir up your mood?
That's a great question.
Why does doing the right thing for your body feel so immediately, intensely bad for your mind?
That is the pivotal question, and honestly, misunderstanding the answer is why millions of quit attempts fail every single year.
Okay, so what's happening?
To understand this, we have to look at the mechanism of those withdrawal symptoms. The foggy focus, the extreme restlessness. When you remove the nicotine, you aren't just removing a toxic chemical from your lungs.
Mm-hmm.
For many people, you are removing a crucial, albeit incredibly harmful, emotional crutch.
A crutch for that co-occurring depression and anxiety you mentioned.
Yes, exactly. If tobacco use disorder rides along with anxiety, it means the nicotine has been artificially managing or masking those anxious feelings.
Wow, okay.
Yeah, think about a teenager dealing with the crushing social anxiety of high school, or maybe an adult managing overwhelming work stress. That hit of nicotine provides a momentary, chemically induced sigh of relief. It physically forces the brain to release dopamine.
So it's basically self-medicating.
Pretty much.
Yeah.
So when you suddenly take that away, you don't just have the physical withdrawal of the brain screaming for its chemical. You also have the underlying anxiety or depression flaring up, totally unmanaged, without its usual chemical dampener.
So the mood disruption, that terrible irritability and anxiety, isn't just you being cranky about not having a cigarette in your hand.
No.
It's your raw, underlying mental health issues rushing to the surface all at once because the dam just broke.
Exactly. That temporary mood disruption is the ambush waiting for anyone who tries to quit. It's a trapdoor.
A trapdoor, I like that.
You throw away the vape, you decide you are done. But 3 days later, your anxiety spikes to unbearable levels, your focus drops to zero, and the quickest, most efficient way your brain knows to fix that horrific feeling is to reach for the nicotine.
Wow. Yeah, it makes perfect sense when you lay it out like that.
And it is the precise reason The source material insists that doing it with professional support works so much better than going it alone. If you try to power through purely on willpower, you are stepping onto that trap door completely blindfolded.
Which logically brings us to the blueprint the briefing provides for actually surviving this process. Because the folks at coping and healing counseling don't just say, hey, you should really get some help.
Right, they don't leave you hanging.
No. They outline an exact evidence-based toolkit for how to beat this.
And it is a highly specific, synergistic combination of tools.
Here's where it gets really interesting. The documentation points to pairing behavioral therapy and motivational interviewing, alongside FDA-approved medications and nicotine replacement provided by a medical prescriber.
Yeah, that dual approach.
It is a multi-layered approach. To me, it sounds like trying to fix a flooded house. You can't just mop the floors while the pipe is still actively bursting, right?
Definitely not.
But turning off the water doesn't magically fix the rot in the drywall either. You need different tools for different parts of the disaster.
That is a perfect analogy. The burst pipe is the biology. Your brain's receptors are physically demanding nicotine. So you use FDA-approved medications and nicotine replacement therapy to address that.
And how do those medications actually work in practice? Do they just, numb you?
Not at all.
Yeah.
These specific FDA-approved medications actually bind to the exact same receptors in your brain that nicotine does.
Oh, really?
Yeah. They effectively block the nicotine from attaching while simultaneously releasing just enough dopamine to ease the withdrawal. It essentially turns down the volume on that biological screaming. It shuts off the burst pipe.
But the house is still flooded.
Exactly. You still have the psychological scaffolding of the addiction. The mental habits, the routines, the emotional reliance on smoking when you feel stressed.
Right.
That is the rot in the drywall. And that's where the behavioral therapy and motivational interviewing come in.
Let's clarify motivational interviewing, because that sounds like a life coach yelling affirmations at you, which I assume is not what's happening.
No. Motivational interviewing isn't about a therapist wagging a finger at you or giving you a generic pep talk.
Okay, good.
It's a highly specialized technique where the therapist asks targeted questions to help you uncover your own internal drive to quit. They help you resolve your own ambivalence, so the motivation comes from inside the house, not from an external lecture.
Oh, that's really cool.
A therapist helps you dismantle those psychological triggers while the medication dismantles the physical cravings.
If we connect this to the bigger picture of healthcare, it highlights a profound truth. There is no magic bullet.
Nope.
You cannot just medicate away a deeply ingrained psychological habit, and you absolutely cannot just talk therapy your way out of severe physiological chemical withdrawal.
Exactly.
The briefing notes this dual approach dramatically improves your chances of success. It's the synergy of treating the mind and the body simultaneously.
The friction of seeking that kind of comprehensive help, however, is often the biggest barrier to actually receiving it.
Oh, absolutely. Think about it from the perspective of someone in the thick of it. If you are already dealing with underlying anxiety, and now you have the foggy focus and intense irritability of nicotine withdrawal, the prospect of navigating the modern healthcare system sounds like an absolute nightmare.
It really does.
Trying to find an in-network provider, taking time off work, sitting in a waiting room while your skin is crawling. It's enough to make anyone just give up and buy a pack of cigarettes.
That administrative friction is where so many recovery journeys end before they even begin.
And that is precisely where the logistics of the coping and healing counseling model come into play. How do they remove the friction to actually get you this team?
They've really thought it through.
They have. The briefing gives us some excellent hard data on this. First, they operate a 100% telehealth IPSARI compliant model. You do this from your living room.
A huge advantage.
And they serve all 159 counties in Georgia. So it doesn't matter if you are in downtown Atlanta or a rural community hours away from a clinic.
The accessibility built into those logistics is staggering, especially when you factor in who is actually providing the care.
Right. They have a diverse, culturally competent team of over 15 licensed therapists. The text uses terms like LCSWs, LPCs, and LMFTs, but for anyone outside the medical field, what that translates to is licensed clinical social workers, professional counselors, and family therapists.
Yeah, highly qualified people.
Essentially, these are professionals deeply trained in the complexities of the human mind. They offer services for individuals, couples, families, and crucially teens, specifically ages 13 and up.
Including adolescents in this model is a vital intervention. We are currently witnessing a massive vaping epidemic hitting middle and high schools.
Yeah, it's everywhere.
Teenagers are developing severe nicotine dependencies before their brains are even fully developed. Providing a frictionless telehealth pathway for a 14-year-old to get specialized help without the stigma of sitting in a traditional addiction clinic is life-changing.
So what does this all mean for the listener?
Well, the financials they provide are the final piece of the puzzle. They've structured this so it doesn't bankrupt you to get help.
Yeah, for folks on Medicaid, it is a $0 copay.
Wow.
Yeah, 0. And for commercial insurances, they list major ones like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. It ranges from a $0 to $40 copay per session.
That's incredibly reasonable.
It is. We'll put all their contact info, like their website, which is hetherapy.com, and their email, support@teachtherapy.com, in the show notes. Or you can call them at 404-832-0102.
Perfect.
But what this ultimately means is that they are systematically dismantling the excuses and the structural barriers that keep people isolated. They eliminate geography and income as roadblocks to getting that team in your corner.
And there's another layer to this CHC model that connects beautifully back to the trapdoor we discussed earlier.
Oh, right, the underlying mental health stuff.
Exactly. The briefing specifically lists the team's other areas of clinical focus. Alongside general therapy, they specialize in treating trauma, PTSD, grief, complex relationships, and severe stress.
Why is that combination of specialties so important for someone who just wants to quit smoking?
Think back to the underlying depression and anxiety that rides along with tobacco use disorder. We established that nicotine often serves as a chemical dampener, right? Masking deeper emotional pain.
Yeah.
When you remove the nicotine, all of that suppressed trauma, grief, or chronic stress floods the system. So having a culturally competent team that is highly specialized in treating trauma and PTSD means they are perfectly positioned to handle the underlying issues that rush to the surface.
That makes total sense.
They aren't just treating the surface-level symptom of the vaping or the smoking. They have the clinical expertise to treat the root cause of why the person was self-medicating to begin with.
They don't just help you put down the cigarette. They help you figure out why you picked it up in the first place, and they have the tools to help you process whatever that was.
Exactly. It's truly comprehensive wraparound care.
Well, we have covered a massive amount of ground today, and I want to quickly recap the journey of this deep dive for you, the listener. We started by throwing out the archaic, toxic idea that failing to quit is a sign of personal weakness.
Good riddance to that.
Yeah. We established that tobacco use disorder is a physiological medical condition driven by a chemical that literally rewires your brain, creating a shifting baseline where you need the substance just to feel normal.
Right.
We explored the mechanics of how quitting temporarily removes a coping mechanism, stirring up intense anxiety and depression, which is the exact ambush point where relapse usually happens.
The trapdoor.
The trapdoor. And finally, we broke down how the team at CHC, through their 100% telehealth model, low copays, and combination of FDA medications and deep behavioral therapy, removes the friction of getting the help you need. Quitting isn't a test of moral strength. It is a complex medical process that requires, and absolutely deserves, expert support.
Beautifully said. And as we wrap up, I want to leave you with a final thought to ponder on your own.
Okay.
We've talked extensively today about how nicotine masks underlying issues, how it serves as a chemical shield against negative emotions.
Yeah.
This raises an important question for anyone listening who is currently struggling. If nicotine has been your chemical shield for years, or even decades, could successfully treating the tobacco addiction actually be the first domino to fall in a much larger journey?
Wow.
Could putting down the vape or the cigarette with the right team supporting you be the catalyst for uncovering, confronting, and finally healing a lifetime of hidden, underlying stressors you didn't even realize you were hiding from?
That is a profound perspective. Healing the physical addiction might just be the gateway to truly healing the self. Thank you so much for joining us on this deep dive today. If you are struggling, please look at the show notes, reach out, and remember that effective, empathetic help exists. It is accessible, and you absolutely deserve a team in your corner. Take care of yourself, and we'll catch you on the next deep dive.